I'm Mohammed Bashir from Kenya. Actually experienced this problem like 3 years ago. It started with shoulder pain, right shoulder pain.
This patient had come from us to Kenya. These set of patients are the patients who would get better by undergoing a procedure or a surgery which is known as a deep brain stimulation surgery. And the maximum number of patients all over the world done by deep brain stimulation has been the Parkinson patient. In this, what we do, we put in an electrode at a place so that the chemical which is produced less in the brain can be helped with the electrical activity. So those electrodes go through two holes, and then these two electrodes are passed through under the skin, connected with the wire, and that is connected with a battery just under the clavicle. And these batteries are rechargeable batteries, and they function for at least 25 years. So the technology has reached to a level where a crippling neurological problem which can make a patient immobile or frozen or dysfunctional or multiple significant tremors, that person after undergoing this procedure or surgery becomes a functional, normal human being.
After day 2 of the surgery from ICU to the ward, we realized that there's some improvement in terms of tremors. It has reduced. So on day 3 again, we were discharged to our lodge. So I really appreciate also Dr. Saroha for taking me through those stages. Now I feel okay. I'm grateful.
These patients undergo this procedure and they are very happy because their life changes upside down. They come back to the stage where they were a few years back, and they go back happy, they live their lives, they start driving, they do their normal day-to-day activities.